Hello, guys and girls. The program you are about to hear will be both fun and educational, but it is not a substitute for medical advice. Although we are doctors, we are not your doctors. Hello, and welcome to Travel Medicine. As always, I'm your friendly neighborhood internal medicine doc, Dr. J.
Hey all, Dr. Santhosh here, pediatric infectious disease doc and researcher after dark.
Oh, it's an After Dark
It
episode. Well,
is.
Santosh, I
Yeah.
got news for you, or more
Mm,
accurately, a question.
okay.
Uh, Based around today's episode, that question, of course, would be: Are you ready to rumble?
Oh
Quietly.
man. Yeah, but still, with our podcast voices. Yeah, yeah.
So,
I would love I don't know the name of that very, very famous announcer who does the Are You Ready to Rumble. I
the
think
let's get ready.
Yeah, the Let's Get Ready to Rumble guy. I think I'd love for him just once in his life to just very casually just walk over to the microphone and say, "Hey, everybody. Everyone ready to rumble?" Yeah, okay.
His name is Michael Buffer, in case you
Michael
were
Buff.
wondering,
Oh, okay.
and
Famous voice. Yeah.
he is now 78 years old.
Oh, damn. And still announcing stuff, I think, right?
Is he still? I think he's yeah. I think he's
Yeah,
still the original Let's Get Ready to Rumble
to
guy.
rumble. Sure, yeah.
Um, did you watch a lot of wrestling as a kid?
I didn't. No, I wasn't a huge fan. I grew up in the land of wrestling, of course. I grew up in Iowa, and these folks they took their wrestling along with Nebraskans very, very seriously, and so I learned all about it. I knew about it, but I was kind of a snobby little kid. I was I'm not very proud of it, but I was a snobby little kid of like, oh, barbarians, like one of those kind of things.
I have grown up loving all forms of wrestling, from the classic 1980s brightly colored ones in Macho Man and Hulk
Yeah,
Hogan to the Undertaker, the modern day ones, and even with AEW and these. So, and I was at an AEW wrestling match in Chicago a couple weeks back, and it got me thinking we haven't covered any of the medical problems or issues that are relatively unique to wrestling across all its subgenres, from professional to luchador to college and I don't know, pediatric wrestling. is
oh
there
yeah.
is there baby wrestling?
Well, no. Well, kids will start their wrestling career somewhere between middle school and high school. Yeah, so it's like I said, it's taken quite seriously. So what you'll have is, young people that will get introduced to the sport. So they might be, gentlemen, of course, boys for the most part, going, okay, well, uh, mom and dad say I have to play a sport, so where do you go for? So you'd say football, track and field, tennis, but then wrestling would be way up there, especially if that corn-fed Iowa boy started getting big at a young age.
So
You
let me ask before we start getting into the medicine and issues with it.
Sure.
With what little you know about wrestling,
Yeah.
I have two important questions. You can answer them now, or you can wait till the end of the episode.
Okay, gotcha.
And home listeners, I want you to think about this too because I'd really just love to hear it. What is your wrestling name, your entrance music, and your
Oh,
signature move?
oh man. Oh, I
Just
know.
the title. You don't have to tell me what the move actually is, but
Yeah,
I want to know
yeah,
the name of your signature move and your entrance music.
yeah. We've definitely uh, we've talked about this before because we've had these discussions about oh, what it would be. Um, I believe we've discussed our rap names before, and I still the title or the name of penicillin is still deep in my soul, but I don't know that. uh, I've really like settled on my wrestling name or entrance music or favorite move. So I can try to save it for the end of the episode
Okay,
and try to.
so let that simmer, and we will
Yeah,
come back. And at the end of the episode, folks, we'll give you our wrestling names, our theme music, and our signature moves. And I want to see you all reach out on social media of your choice and tell me yours.
yeah.
But let's get into it. So we'll start off, at the basic level. There's two internationally recognized forms of competitive wrestling: freestyle and Greco-Roman. We're not going to get into sumo, really. A lot of this stuff, just some of it would apply, some wouldn't. So we're just going to focus on Western wrestling.
Yeah, this is what you'll see at the Olympics, for instance.
In both styles, competitors will wrestle in 2 to 3 minute periods. You get points for takedowns, escapes, reversals, and pins. Freestyle is the most popular, and athletes can use their entire body. Greco Roman, you can only utilize the upper body.
So in terms of freestyle, if you pin, that's the one where you see them, they can use their legs or something to lock someone into place or something like that. Whereas Greco-Roman, in order to get someone into a hold or a pin, you can only use arms and chest.
During a match, wrestlers are allowed 1.5 minutes of cumulative injury time
Whoa,
across the match.
whoa, okay. So they're allowed to hurt each other for 90 seconds. Okay.
2 to 3 minute period, but so you have 2 to 3 periods, each lasting 2 to 3 minutes, but you only get 90 seconds of time being injured across that match.
Oh, okay.
High school athletes are permitted 5 minutes of cumulative bleeding time,
Oh,
wh-
okay.
whereas at the collegiate level, the length of bleeding timeouts are left to the discretion of the referee.
So this is if you have a cut that's really bad or probably hampering your ability. So if it's over your ear or over your eye, right?
Or if it will not stop with on-site medical treatment, you can have up to cumulative 5 minutes of bleeding time before the match is just called for injury. But
Wow.
once you're in college, the referee gets to decide, no, he hasn't bled enough, he's still got some more
Well,
left in him. Those of you who are very deep into the wrestling world can probably correct me extensively, but WWE, which was
yeah,
sort of the former wrestling that we all grew up with, really has scaled back on this. They do not want bloody matches. Once in a while, or for certain wrestlers, they'll allow it. Uh, AEW, on the other hand, All Elite Wrestling, is practically a free for all, and it at the end of some matches, it was a relative slaughterhouse. And I don't care what you say about fake wrestling, there are not blood bags hidden in cuts above your head or in your
yeah.
face. People are injured. I still contend that it is a sport, whether or not it is scripted.
Oh no, 100%. And this has to do with any other kind of performative art, right? So competitive sports, as we know of, that they go by the rules, they try to do what they can. In this kind of professional wrestling that you're talking about, it tells a story. So there's going to be a winner and a loser that's determined to the best of their ability ahead of time. I know that can be changed, but there are other forms of play battle, on stage fighting, and then the stunt men and that kind of thing in movies, and all those folks along with the wrestlers are athletes. You better the heck believe it.
So I don't care if the match is fixed. If you walk into a ring knowing you are going to get your face beaten in, you earn all the points of any other athlete.
Yep.
In fact, it's even worse because you're like, I have to take a beating and
Yeah.
still admit defeat. There's no
Yeah.
comeback. So, but let's get away from cumulative bleeding time and discretion of the referee and talk about the oldest named wrestling associated condition. And you always get very excited
Yeah.
about this, Santosh.
Well,
So,
I don't like it for the sake of the actual disease because it's it's not a great disease to have. But yeah, it's up my alley. People don't usually think of infections when they think, wrestling. They think of injuries.
what is our wrestling named infection?
Named infection is going to sound very familiar to anybody who grew up in the 1980s. It is a herpes infection, so it's an outbreak of, the blisters and stuff that herpes causes on your skin. But because it's named after the wrestlers, it is called herpes gladiatorum.
Of course, gladiators, the
Yes.
earliest forms of professional entertainment athletes.
Right, exactly. Which
So,
is I
where
always
does.
love the double entendre because gladiator comes from the gladius, right? Like the sword that they have. So
Hmm.
it's a and HSV kind of like stings, like you're getting stuck with a sword. Anyway, I'm probably taking it
Oh,
too
sword herpes, almost as
far.
good. Where does herpes gladiatorum appear?
So you're going to talk about contact surfaces, really between two people. These two wrestlers are getting very, very close to one another, or as I've been told before, Josh, three, four, five wrestlers sometimes, right? In the professional ranks, when there's, I don't know what they call it, like the
Well, when you have elimination
crucial.
rounds, you could have like 25 to 30 people in a single ring.
Whoa. Okay. Okay. So lots of people rubbing up against each other, right? Anytime that happens, you're going to have exchange of fluids and skin cells and all these kind of things. If it so happens that a person is shedding herpes simplex virus somewhere on skin, touching skin, and it can be asymptomatic, although it's much more contagious if you have an open blister and that kind of a thing. But the other person, especially if they have not had herpes before of any kind, can acquire that. It doesn't take a lot of abrasion to the skin. And then, unfortunately, they down the road can get another outbreak where that HSV was inoculated. And depending on their individual circumstances, it can be very serious and bad and ugly looking. Or in some cases, they'll just be asymptomatic for a long period of time.
The herpes simplex virus, regardless of what catchy name we give it,
Yeah.
will regularly rear its vesicular ulcerous face on wrestlers. A research group checking serum samples from wrestlers across all ages to determine previous exposure found that 30% of college wrestlers had reported a previous infection of herpes. And they gave numbers for professional and high school as well, but essentially the level of intimacy required in grappling makes it inevitable that something is going to be transmitted: sweat, saliva, blood, and that gets
And
us into
yeah.
bloodborne infections, and then, of course, HSV. So,
Yes.
fun fact: how do you tell if a wrestler is right or left handed?
Look for where you can find lesions if they have lesions.
Check which side of their face, head, neck, and arms has the greatest number of lesions. And that's because athletes will tend to prominently use the most powerful side of their body, and that will be the side that has the greatest amount of skin to skin contact and therefore at the greatest risk for developing an infection.
Okay, gotcha. So this does, it's with the added caveat that they do have to have herpes gladiatorum, herpetic infection, and it should be active at the time, and then you can use this little hint.
Well, and then you can't really wrestle if it's active at the time. So it's a little bit of a catch
Oh,
22.
sure. Okay.
Like if
So,
somebody shows up, and we'll get into that in a moment, but if someone shows up and they have active herpetic lesions, they are not going into the ring. So
okay.
you have to notice these strong side things before you get into a fight with them. uh,
Sure, sure. Okay. Yeah, just like part
now
of their medical checkup.
herpes gladiatorum, fun as it is to say, really only covers herpetic infections, but we have a whole group, and tinea gladiatorum groups several different fungal infections that these gladiators of the ring are
Yeah,
susceptible to, including, and I'll let you give a brief description of them, Santosh, but
sure.
tinea capitis,
So
no cap,
that's
no cap.
no cap. So just what, yeah, exactly what it alludes to. So tinea, we're talking about fungal infections right now. So tinea on the head,
Corporis,
anywhere along the body, but usually in areas where there are skin folds, like under your armpits or your folds of fat, if there are any.
cruris,
That's going to be in the groin, and Usually that's just from sweat and heat accumulating rather than like skin to skin stuff passing on.
And pedis.
Those are the feet. Those that's not
Pedis with a D.
Yes, yeah, yeah. So, if anybody is out there thinking of pediatrics, right? So, pediatrics comes from the root of actually taking care of feet and bones because that's a lot of the pathology that early pediatricians dealt with. So, pedis doesn't mean kids or the other thing, but it's actually your feet. So that's athlete's foot.
Which is weird because you would think podiatrists would have seized on that,
Yeah,
but pediatrics had already stolen their specialty. So
yeah,
such is the world. So tinea is a pretty common occurrence among most athletes. I mean, it's jock itch is another common name
yes,
for at
that's
least
the
one of them.
tinea cruris. Yeah, his jock itch. Yeah.
And it usually presents with itching, redness of the area. It may get scaled. Um, you can have bacterial infections like impetigo or
Uh huh.
cellulitis, and those have to be treated with topical antibiotics, so actual antibiotic creams that you smear on the skin, or incision and drainage. And I cannot tell you how many wrestlers I have treated in my career that have little boils and abscesses, usually in the groin, or if you want to use the unscientific term, the taint.
Yes. Yeah.
Uh,
The perineum is what you're saying.
yes.
Okay,
Um,
gotcha. Okay.
and they very often tend to be drug resistant abscesses because it is not the first time an abscess has formed in that area for the wrestler.
Right, meaning that they've taken multiple courses of antibiotics before, or it is possible that if they're in a community where they're wrestling and they encounter a lot of people with resistant organisms just colonizing their skin, that type of bacterial infect well, I shouldn't even say infection, that bacteria, and we're thinking of Staph aureus, will pass on just because there's intimate contact, it's touching and touching. You can imagine, Josh, throughout all of this, that it's kind of tough to differentiate sometimes between these. A viral infection like HSV can be blistering, but there could also be something pustular or red. Is it herpetic? Is it bacterial? And then if you get that scaly, almost cheesy kind of a look, it should be fungal. But they don't always present classically, so that can lead to mistreatment, giving the wrong agent for the wrong kind of disease, or sometimes unnecessary antibiotics and things like that if you accidentally try to give an antibiotic for a herpetic infection. So you have to get really good at telling these apart and then using your diagnostic skills and your methods that you have available to you, like culture and molecular methods like PCR, to detect HSV.
So I'm going to go through a very quick and dirty, haha, run
Yeah.
through of return to play guidelines for infections because I think those of you who participate in college wrestling or who watch professional wrestling do not tend to see people with noticeable skin infections. And that is good. You shouldn't.
Yes.
But
Yeah.
how recently did they have the infection? So, for any kind of herpetic lesion, which is characterized by a vesicle or a blister filled with clear fluid on a reddish background, but it'll develop for about 7 to 10 days. And then, as you said, Santos, they may burst, they may become dry and crusted. So, an initial outbreak requires a minimum of 10 to 14 days of treatment. And if it's a recurrent outbreak, meaning it's happened before, they have to complete a minimum of 5 days on antiviral medication, and you have to be free of fever, swollen lymph nodes, and existing lesions have to be scabbed over. It has to be a dry crust, so nothing wet, no oozing, no discharge, no new blisters in the last 72 hours.
Now, you can imagine this can be just a little bit difficult because, yes, we've told the wrestler in this case not to be on the mat, don't be interacting with other people so we don't spread this around. But Josh, they may decide to do something like exercising, and they could open up new blisters, have it spread like this because they're still not practicing good hygiene. So this is why we set those minimum conditions. It could take longer.
One of the very specific things about herpes that we may not hear with some of these other infections is that active lesions cannot just be covered to allow participation. There are some
Yes.
infections that you can just cover up. Herpes is not one of them. So, 72 hours with no new blisters, as well as treatment, before you can get back in the ring.
And if anybody out there is wondering why, because you might have some expertise here and you say, oh, if you cover up, usually with HSV, if you cover up, then that layer of gauze with some tape is usually plenty in order to stop transmission of the virus, right? But we're not dealing with a commonplace type of scenario here. Okay. These folks are clashing and rubbing up against each other. Those dressings are going to fall off like seconds after they enter the ring, especially with sweat, right, Josh? So you can't trust a dressing to stay on.
Tinea, the whole gladiatorum ones, just it
Yeah.
it's Latin for ringworm. It's a
Yeah.
fungal infection
Yeah.
that usually forms some form of ring on the body. It could be round and reddened and scaly. On the scalp, it can be gray and scaly. On the feet, it's thick and scaly. Are you
Yeah.
sensing a pattern?
Yeah. And the skin can kind of pile up a little bit in reaction, like inflammatory reaction to the fungus, and get we sometimes use the word beefy, Josh.
So, in order to return to play with a tinea infection, same thing. You have to have at least 72 hours of treatment, or 2 weeks if it's on the scalp, because there's a lot of head to head contact in wrestling,
Yeah,
or
yeah.
head to mat, or head to chair. Your scalp is more
head,
important.
head to baseball bat, sure.
Once the lesion is no longer considered to be contagious, then you can just cover it up with an occlusive dressing and they're cleared to return. So you can still have an active lesion that is outside the contagious period and go into a ring to wrestle with that.
Yeah, and tinea can be awfully tough to deal with, right? Because anytime you have heat, moisture, and absence of light, so darkness, that fungus loves to grow. Yes, you've told them to stay away from wrestling for a bit, but again, hygiene is really, really important. All of those places that we talked about, corporus can happen, in your hair that traps moisture and that kind of thing. But crurus, pedis, corporus, they're all going to happen in skin folds where you can trap a lot of heat and moisture and it's nice and dark. You have to tell them to, like, hey, wash up really well, but then dry your skin really well, air it out, and use, the antifungals and soaps and everything that we give you, or it's going to just be a bear to heal.
Another one that is relatively common, but we don't hear about it a lot, or at least I don't, is molluscum contagiosum.
Oh yeah,
Uh, and so it looks like, light pink, pearly little pimples with a dent or depression in the middle. So think pimples with dimples.
yeah. We actually call that little dimple an umbilication.
So in order to return to play, you just have to scrape the whole pimple out by a physician, and then you can cover it up and get back to play. So you can have an active one, and they're just like, all right, let's just stab that, scoop it, and off you go. Slap on the ass, get back in there, sport.
And this one's caused by a virus. It's actually a pox virus, believe it or not, and it's not terribly harmful, Josh. Actually, if you have an intact immune system, actually most of these, I'd say HSV, tinea, it's just that they are absolutely tenacious and annoying. And molluscum specifically, if you even scratch it a little bit and then you scratch another part of your body, you will self inoculate, so you'll propagate this thing around your body. So you do have to act on it pretty quickly. We have a few other modalities besides scooping. You can use some cold therapy, or if you're technologically inclined, you can use a giant laser.
And then there's another group that I call the wrestling staff, which is impetigo,
Mhm.
which also folliculitis, furuncles, carbuncles, um,
Yeah,
and
yeah.
MRSA.
It's your carby uncle and it's your furry uncle that shows up just when you don't want him to.
So folliculitis is the hair follicles. Again, the scalp. Furuncles are tender and red and nodular.
Yep.
Carbuncles are when a bunch of furuncles join up.
Don't know. It's a carb of uncles. Yeah, exactly. Yeah, furuncles can happen anywhere you have skin follicles, right? So along your arms, legs, back, chest, all these kind of things. And again, it can be very annoying, not necessarily deadly or scary. Put you
Now,
in.
the reason I keep, and again, for all of these, you need at
Yeah,
least 72 hours of antibiotic therapy. And here's where I'd like you to comment, Santosh, because most of these infections we tend to treat with a longer than 3 day antibiotic course.
yeah.
Now, I don't tend to see, things like folliculitis in a hospital setting. That doesn't usually require
Right,
that level of care.
right.
Uh, Not that said, my experience with most antibiotics is outside of urinary tract infections, most things are at least a 5 day course. So the fact that you only have to get through most of the antibiotics before you can get back into wrestling, I find to be interesting. Although, again, no new skin lesions for at least 48 hours, and anything active or wet or open means no covering it up, cannot return to competition.
Yeah, skin infections are forgiving because the actual cells actually shed off, right? And if there's a pimple that you can actually lance and drain, then that's the number one principle of taking care of infections is source control, right? So if you can do that, if you can take care of the source of the infection, that does most of the heavy lifting, and then just a short course of effective antibiotics. So you do have to pick the right agent, right? Some people actually go way too broad and pick the wrong thing. So the thing you said at the very beginning, Josh, when you were talking about incising and draining some of these things, that actually is the treatment for most of these. If you get a pimple or a pus filled, blob, that actually does so much more than the antibiotics do. And in fairly mild to moderate cases, if you're able to drain all that pus out of there, send it for a culture, never forget, and you can sometimes even just give a dose or a couple of doses of antibiotics or just topical antibiotics, and it'll heal up as long as the wrestler leaves it alone and takes good care of their body to heal up properly.
WWE famously was kind of anti-union. All of its wrestlers were independent contractors, but
Oof,
they were locked into a contract, which meant they couldn't work anywhere else. And as independent contractors, WWE didn't offer health insurance. They were
horrible.
not
Yeah,
employees. And
yeah.
that meant that a lot of wrestlers would continue wrestling even in conditions they knew were dangerous because they did not have an alternative source of income. That's what allowed, in wrestling history, some of these other leagues to spring up. One of the more popular ones now being All Elite Wrestling, or AEW, that does in fact consider anybody working for them as a employee and eligible for health insurance. So you've seen a lot of wrestlers who we maybe grew up with and knew the names of shift over, change names, change costumes because they are in a safer overall medical environment.
Oh, that's a good thing. That's really good to hear. Not just for the individual to help them take care of themselves and get them money, when they can't earn it on the ring, but it's also really, really good for public health, right? Because you're stopping the propagation of these infections from person to person.
So, the role of medical personnel, in addition to recognizing and managing injuries like head and neck trauma, which we'll get to, is
Yeah, yeah.
essentially to do an on mat evaluation of the wrestler to determine his or her ability to safely continue within a very limited amount of time. You can't be doing a full triage on somebody or a regular hospital workup. You got to look at the mat and be like, all right, this has to be addressed now. This can wait till the end of the match. This requires the match ending. Those kinds of things. They also kind of work as sort of the people you have in your corner, as they're there to control bleeding, minimize blood exposure to other athletes, and provide treatment for an injury after a tournament or match, along with education on prevention, rehabilitation, and return to play guidelines.
Cool. Okay, so they have to be kind of specialists. And I'm sure you could start off being, I'm guessing, family medicine or pediatrics or internal medicine or something like that. But it sounds like in order to recognize, these types of injuries along with infections and then be able to provide, first aid care right then and there, there's probably some amount of experience and specialization that you should really have
I
to
feel
help
like it
them.
ends up falling into some mix of infectious disease, ER, and ortho.
Yeah, yeah.
Like you need some fusion of those three specialties.
Yeah, I mean, emergency medicine is actually a pretty good for this because they have to have recognition, very good broad recognition of common entities like this. So that would make a ton of sense for someone to do this. Training in sports medicine would probably be good too. I would think that a sports medicine doc would be able to recognize some of these skin diseases and stuff because they're fairly common. They do happen, by the way, to all of the rest of us, just with much, much differing frequencies because we're not being hot and sweaty and rubbing up on each other all the time. At least I'm not. I don't know if you are, Josh.
I mean, on a good Tuesday. Briefly going back to college. So I mean, again, I'm really focused on professional wrestling, which can be anything from individual one-on-one matches, tag team matches, ring outs, massive eliminations. There's so many different ways, but the skin to skin exposure is largely the same. The risk of injury goes up the more people you have in a ring, and that's true at the college level too. College level matches tend to proceed in 3 rounds of two with
Okay.
one trainer per 2 mats. So that's sort of the medical coverage. One trainer per 2 mats allows for quick response times and a higher likelihood that you witnessed how the person got injured. Um,
Oh, okay. That's wonderful. I wasn't really considering that. I thought that during a meet there would be maybe one professional with a few helpers or something like that. That sounds a lot more generous.
So you have one trainer per 2 mats. Matches are generally stopped for injury timeouts at the referee's discretion. You have to know where the trainer is, as
Okay.
well as the referee. If the
Okay.
ratio of providers to matches is not as favorable, and like you have 4 matches to only one trainer, then you can try and locate as centrally as possible for the greatest visibility and quickest access to the athletes. We should ask Ward how fast he can triage assessing injuries occurring in real time on the fly without the benefit of imaging.
They would have to rely on clinical skills. So, actually, using your hands, eyes, asking the athlete to do certain maneuvers. So, for instance, with their shoulder, can you raise your hand? Can you drop it back? Can you reach up, behind you and put your the flat of your hand over your back? Can you rotate your wrist, elbow, flex it, and extend it? All these kind of things. You'd have to do that.
But while you're doing this, your back is turned on at least one other match.
I see. And they have to go on, I'm guessing. Otherwise, you'd be there all day if each match was
Right.
paused
And then you
for.
have to say, all right, let's go back and get this person can go back to play. This person can't. I need to keep an eye on, oh, maybe I noticed something as the injury was occurring. So it really is instantaneous triage.
Wow. Okay, okay. So you gotta work on what we call, and I think Ward Dr. Ward would be wonderful for this because there's such a thing as called a 3 second physical. It was boom, boom, boom. So what's your
It's what
impression?
you do
And then
after 20 years as an attending.
well, it is. Yeah, that's you gain this kind of mastery, especially there's something that we talk about in pediatrics, which is it sounds really, really simple, but you say the first thing that you want to know is that patient sick or are they not sick? And it sounds really silly, non-technical, that kind of a thing. But that's our instant assessment, and we gain this kind of an instinct or mastery just after seeing 10,000, 20,000 patients.
So let's talk about a partial list of the medical supplies needed to cover a wrestling match. And you will see these at every level: high school, college, pro wrestling, lucha, which is more marked by just masks and high flying. So you have a
Yeah.
couple unique injuries for lucha that are related to costuming that may stay on,
Oh,
or
sure.
the increased level of acrobatics. Beyond mentioning that, not really a lot to go into. So when we say professional, just assume we're including lucha. Things you need: ample suture supplies, especially for the larger tournaments.
When you talked to me about that, Josh, and because you talked about the cuts and everything that you see in the all elite wrestling, I was a bit surprised. I have to admit, I didn't know that they would have that many like lacerations and cuts. I thought this was all like blunt force injury, but I guess not.
But you can hit the turnbuckle, which is the little corner area of the ring. You can smash your head on the ring itself. You can just take punches to the face,
Ugh.
or a chair to the head. So there's a lot of things that can open up cuts.
Okay, all
Uh,
right, so, which will kind of split open the skin rather than a cut the way that like a knife would be or something like that.
mhm.
Okay,
They're shear injuries,
got it, got it. Okay.
usually. Dental rolls, pre prepared.
Oh, sure. Okay.
Coban tape, 3M, St. Paul, any of those.
Athletic tape. Okay.
You know what makes tape athletic?
I think it's the way that it adheres to itself and kind of stretchiness, right?
Made of non-stretch cotton and has a zinc-based glue, and it's meant to allow you to flex and move. Whereas if you think about, you ever put a Band-Aid wrapped around your knuckle when you get the
Yeah.
inevitable paper cut there?
And it lasts about 2 seconds. Yeah.
And yeah, the second you start bending your hands to be like, how injured? Does it still hurt? Yep. Um,
Yeah.
Athletic tape bends with you. It's meant to be flexible.
Okay, got it.
So fun side fact. So Coban or athletic tape supplies to drain and splint auricular hematomas. I mean, it's cauliflower ear.
Not like in the ear canal, but actually in the tissue of the outside of the ear, like the pinna or the tragus.
Yes.
Oh, because if you get a bruise or something and blood flows into that area, it has nowhere to drain.
Right. So instead, it just kind of blows up, and then your ear looks like. Listen, if you've seen a
Yeah.
cauliflower ear, you know it.
So this would actually, in order to actually cut it and drain the blood out, this would be to prevent the cauliflower from happening because that's what happened when it like puffs up like that and then it scars and fibroses and stays that way.
Consider consent forms or documentation
Okay.
forms.
Oh, sure. Yeah. No, I'm sure in high school wrestling for sure it's and college it is up and down consent and documentation and all this kind of a thing.
Splints, gloves, tegaderm for covering skin lesions, a headlamp, and an eye kit because you want to assess for concussions. And there's a couple. So those were the infectious diseases.
Yeah.
We'll get into the more musculoskeletal ones in just a second.
Oh, sure.
First, let's talk about the major difference between amateur and college wrestlers.
Wait, Josh. Before we do that, should we put in a I don't know what you call an interval in wrestling for our wonderful ads and what have you that help us pay our bills?
We'll be right back
To rumble.
to Rumble. And we're back.
It gets me every time. I don't know why.
So, what's the difference between professional and amateur or college wrestling? College and high school wrestlers pretty much stay on the mat.
Yeah.
Like, they're not doing any high flying off the ring flips. They're not breaking through tables. They're not getting hit with external objects. So, that's
Yeah. Although these are big, powerful individuals, and they'll use their fists, and they're not allowed to punch or strike. But I think in Greco-Roman, Josh, you're allowed to like strike the side of the head and the ears with like the heel of your hand, right?
yes.
Oh, jeez. Okay.
So, so the biggest thing at the amateur level is sprained ankles and knees, back and shoulder issues, and lacerations. But at the end of the day, gravity is gravity.
Sure.
So that you're right would be kind of like a sports medicine or a ER broad thing. So now let's talk about some of the injuries that start coming up in other cases. So we'll work
Okay.
our way from and I know this is very relative, but least to most serious, meniscal injuries.
Oh,
Very,
yeah.
very common due to increased torsion forces, lateral more than medial. So, what's a meniscal injury? Where is your meniscus?
So the meniscus, you can imagine your knee the way it's flexing, right? You don't have bone touching bone there. Otherwise, you'd grind your knees to dust. There's a beautiful cushion of cartilage that sits right between the end of your femur, which is your thigh bone, and your tibia, which is your shin bone. And there is, further out to the side, you can call it, which is what we call lateral, and then medial, which is closer to the center line of your body, a little, almost like a, you can think of it like a kidney shape, like a U shape of cartilage that cushions those bony surfaces.
So that's due to, quick turn injuries or increased torsion.
Yeah.
And you'll usually see tenderness at the joint and a little bit of like a slow building fluid
Yeah.
behind it.
Yeah. So you actually go to, this is the one of those things, right? You have to quickly assess the knee if a person, standing tries, falls down, something like that. And then, you push on it and it bounces back.
Yeah, so this
Yeah.
will feel like your knee is locking, catching, or giving out. So if there's full range of motion, no mechanical symptoms, you can allow the athlete to return to play if they desire.
Mhm.
You should watch for very isolated lateral collateral ligament sprains. So rather than medial, a pop on the outside of the knee and then significant tenderness among that area, but not much swelling. In order to test this, you're asked to kind of cross your injured leg over your non injured knee, making like a figure four.
Yep. Mhm.
So then you feel along the outside of the knee, searching for that lateral collateral ligament, the LCL, should feel like a tight cord. Um, in fact, you may even be able to palpate it yourself
On yourself.
against
Yeah.
on yourself as you're sitting there. Go ahead, cross your leg, and kind of feel what feels like a tight cord. If you can't feel a cord and it's kind of loose, then you would be worried about a complete tear of that ligament, and that has to be treated and operated on within about a week.
Yeah, otherwise you're going to start getting contractures, like bunching up of the muscles that actually insert into that point, and it's going to get more and more frayed to the point where it's going to become irreparable unless you actually cut stuff away in order to link it back up. So it's not an emergency, but it's urgent, and you have to stop using it
Uh,
immediately.
then prepatellar bursitis or pes anserine bursitis, very very common, just due to friction against the mat. That's the actual front part of your knee becoming swollen and inflamed. It's not an infection; it's just an inflammation.
Yes, yeah,
And
just rub, rub, rub.
usually wrestlers can continue with that. You just get rest, ice, compression. That's why you'll see a lot of wrestlers wearing knee pads as part of their costumes or having some form of knee protection.
Yeah, I can't stress enough, Josh, the amount of force that's being applied to these athletes' legs, right? So you've got all the weight of the athlete, and then you're carrying or moving or trying to move someone of equal, height and weight usually, and they're putting even more force, jamming down on your legs, your hips, and everything else like that. A lot of these ligaments and stuff, you can work out your muscles, right? You can make them stronger and stronger, but these ligaments and cartilage, they're not necessarily meant to take this kind of a force. And it's really important in high school and college to think about these, because these bodies are still developing. So sometimes you get people who can exert a lot more force on there than the ligaments and the cartilage and everything that can actually take.
Moving up the body, we get to the ribs, and those are very common injuries. You get compression, torsion, direct impact. I mean, if somebody's jumping off a top rope and landing on you,
Yeah. Yeah. Yeah.
you know, the differential for an acute rib injury, you have just a muscle strain or a subluxation of the rib where it slides underneath,
Yeah,
or
yeah. Uh-huh.
an outright fracture. So you should listen with a stethoscope. You're listening for kind of crackling Rice Krispie sort of sounds, or
God,
well,
gross.
that's crepitus,
Yeah, I
or
know, but I can like feel it.
pulmonary complications like a pneumothorax. A part of your lung balloon bursts open, so you actually won't hear any breath sounds. Um, if you have a rib injury, returning to play is pretty controversial. In the most liberal definition, you want to make sure they can take full breaths. But if they've suffered any kind of acute rib fracture or injury, it's not advised for them to get back in the ring.
Yeah, what portends more serious injury across the ribs is if they've already suffered an injury, right? So you've got layers of tissue protecting the actual bone, thankfully. So you've got lots of muscles, and people actually work on building this, the wall of your chest in order to make it nice and strong so that you can withstand some of these things. But if you've bruised already, or if you've maybe had a minor type of an injury, you're now predisposed to getting a worse injury if you try to keep pushing through it, so to speak.
Now, while we have lacerations that will bleed, a nosebleed has to either spontaneously resolve, or if it's going for longer than 3 minutes, remember cumulative bleeding time,
Yep.
you can get a nose rocket, also known as
Yeah.
a pledget.
Yeah.
And you may even dip it in a medication like phenylephrine or oxymetazoline to further constrict the vessels in the nose.
Yeah, and you don't want to use those too often, because if you cut off the circulation to your nose, it's not so scary that like, oh, your nose is going to fall off or something weird like that, but you can actually damage those very delicate, wonderful tissues on the inside, like your turbinates and things, leading to chronic rhinitis and sinus issues and things like that. So, you
You
want to
basically
address
have a
this.
little infarction, and
Mhm.
then the main purpose of your nose, which is to block outside things from getting in, such as
Doesn't.
infections,
Yeah, yeah.
doesn't.
Exactly. So,
Um,
and you can damage your sense of smell, which is a wonderful, wonderful thing, and you don't want to lose that. So, yeah, taking care of it quickly and getting the bleeding stopped without having to use those medications is important. If you have to resort to those too often, then the bleeding is too much, and you should stop and probably go get checked out by a ear, nose, and throat specialist.
and then for any of the bleeding things, you basically the threshold is you have to have the ability to suture a laceration within 6 hours from the time of injury. And that can help them avoid a long wait in the emergency room and allow wrestlers to continue on in their tournaments or matches. If they will not be finished wrestling within 6 hours, you it's preferable to wait to repair the wound as long as you've had hemostasis. So as long as it stopped bleeding, you
Yeah.
don't have to repair it right away as long as they'll be done wrestling within 6 hours.
Who wrestles for 6 hours? Or this is intermittent, like they do a match and then they won't.
Right. So at the college level, you may have several bouts and you get a laceration in one. And if you're going to be done with your day in 6 hours, then you're good. If you're at an AEW event
Gotcha.
and you have the first match and then maybe you're going to make a surprise appearance or you're in this other one, because wrestling shows will go for 3 to 4 hours.
Oh, wow, okay. I
So
wasn't
unless
thinking
you are
about that.
leaving
Yeah.
immediately after
Yeah.
and you're only showing up once for the night, if it's going to be 6 hours or less, you do take care of it after the match as long as you've stopped the bleeding. Longer than 6 hours, maybe better to go.
Gotcha. And so we're dealing with everything from, really shallow, just what you were saying, like shears, where you get a little bit of a skin tear, you use that wonderful super glue type stuff, and it closes up, all the way to, if you get a split famously above your eyebrow, because that skin is quite delicate, and a blow to that area could really split open the skin, and you need to throw in some sutures right away. Are you saying, Josh, that in some of those cases they can put sutures in and then go back in the ring? Like, because
I'm saying as long as they've stopped the bleeding, or
Okay.
with like butterfly stitches or things like that, they can go back
Sure.
in and then do a proper repair with sutures later.
After. Oh,
As long
wow.
as they
Okay.
will be done with all their required wrestling within 6 hours and they're not actively bleeding, that's
Okay.
fine. You don't have to send them off to the emergency room.
That scares me a little bit because I just imagine someone who keeps splitting the same thing open over and over. But okay, got it.
So that's it. You want to get any laceration sutured within 6 hours from the time of injury in the wrestling world. Your mileage may vary.
Yeah, okay, got it. All
So now
right.
let's finish it out with some banned wrestling moves. Now some of these have come back
Okay.
in other forms. Some of them are banned in one field like WWE, but may be allowed by AEW, which only started in 2019, I think.
Oh, okay, gotcha.
Um, and we've seen WWE, relieve a few superstars from their contracts following complaints by their colleagues that they're not safe workers in the ring, and others are praised for being extremely safe. And even with that, accidents will happen. So, for example, during a dark match on Raw in 2015,
Okay.
Tyson Kidd, a young wrestler who's not competing anymore, was asked to work with a longtime staple of the wrestling world, Samoa Joe.
Okay. Okay.
Um, Most of the match went fine, but the end of the match, Joe lifted Kidd for the Muscle Buster, which was his finishing move early in his WWE
Oh
career.
God. Okay. Okay.
And WWE banned the move after Joe used it on Tyson Kidd because he
Okay.
went ahead with the move. However, he wasn't prepared to land well because he hadn't worked with Joe before, and he
Okay.
ended up breaking his neck with a spinal cord concussion, meaning the
Oh,
ligament holding C2, the disc right up almost at the top of your skull on your neck,
yeah.
uh, the disc hit the spinal cord and caused temporary paralysis.
Oh, because it actually bruised, your spinal cord being a giant bundle of nerves, it actually bruised the cord.
Yeah, so
Oh
they banned
gosh.
it basically because now, thankfully, Tyson Kidd had temporary instead of permanent paralysis, but did not
Sure.
return to wrestling afterward. And Samoa Joe, who was very concerned about this, has never used the move in WWE since.
Sure,
And it's
sure,
been a banned
absolutely.
move, although you have seen some versions of a Muscle Buster show up later. So now let's start talking about some of the others.
Okay.
The Pedigree by Triple H. And it's
Oh,
sad that you're not
okay.
going to recognize any of these, Santosh. Like I have other colleagues and friends who'd be like, "Oh, the
Yeah.
Pedigree."
Yeah.
Um,
So Triple H, I know, is a like Hall of Fame, super duper, name in wrestling. A little bit up there, like Honky Tonk Man or Hulk Hogan. Like he was famous, famous, famous,
so
right?
I could describe some of these, but realistically, go to YouTube, go to TikTok, just watch it. It's just fun.
Yeah,
Um,
it
I
is.
mean,
As
when
long as
done,
it's injury
safely.
free. Yes. Yeah.
So
Exactly.
Triple H, his special move was the Pedigree, and when he first started doing the move, he wasn't unlocking the arms of the competitor soon enough, which led to
Okay.
some scary moments for those taking the maneuver because they could basically slam their face on the mat with no protection.
Oh,
So
so in this case, like the his opponent's arms are locked away where they can't break their fall.
yeah.
Got
So
it.
the original version of the move made it very difficult without a risk for a permanent head and neck injury, because
Okay.
you're taking a lot of force right to the face. After it
Oh,
was banned, Triple H modified the pedigree to make it safer by just unlocking the arms earlier in the move, so the opponent could put their hands out to safely take the bump.
okay, gotcha. Okay, cool.
Another wrestler, RVD, is known for the 5-star frog splash,
Oh God. Okay.
and he'll kind of climb up the ropes, jump off, and change direction in midair before landing on his opponent.
How? Oh, he twists around.
Yeah, yeah.
Okay, gotcha.
So
Okay.
during one of the first ever elimination chamber matches in 2002, he tried to do this move on Triple H.
Oh, okay, gotcha.
However, the height of the structure, like kind of the cage match,
Right.
prevented him from getting enough momentum to successfully hit the move and go far enough. So he wasn't able to climb high enough and jump kind of over. So instead, his knee connected with Triple H's throat and crushed his larynx.
Oh my god. I mean, that's deadly. What happened?
Well, Triple H survived,
Oh,
but
okay.
was not thrilled, and
Sure.
the 5-star frog splash became a banned move. And in this case, it was because he didn't have enough height to build up the momentum to get far enough over the person. And Triple H is a big guy.
Sure, oh,
Um,
as in tall as well. Got it, got
yeah,
it. Okay.
yeah.
So they just said, all right, you instead of like trying to practice it in order to get it right so that you can get over, just no, no more.
Just no. And sometimes that's all that it takes. One bad injury, because this is a move that he didn't know he didn't have enough height to do. He thought he was
Yeah,
doing it safely, and there simply was not the proper environment to pull it off.
sure.
Um, One that was banned and has kind of made a comeback,
Oh no.
perhaps dubiously, is
Okay.
known as the buckle bomb. And that
Okay.
is a variation of the power bomb that's been pretty popular in a lot of pro wrestling rings. Uh,
Okay.
Now, in a power bomb, the opponent's kind of driven into the mat, but in a buckle bomb, they're driven into the turnbuckle, those four corners.
Oh God. Okay. I mean, they're padded, but that must because that's a very narrow space imparting a lot of force rather than a big mat.
And the key to
Uh,
doing it safely is it's entirely up to the guy giving it, that you need to make sure that your opponent hits the buckle above your shoulder blades, but not with your neck.
oh, I okay. So this is another, not snapping the neck, not crushing the larynx type of thing. But I imagine that's kind of hard to maneuver just right.
Now, that's not one particular wrestler's move. Lots of wrestlers use it, and it is, I believe, the most recent or latest move to be banned by the WWE. AEW, I
Got it.
think, still allows it, but
Oh,
I'm
okay.
I'm not sure. And like I said, AEW, although they do provide healthcare to their wrestlers, seems to play a little bit more fast and loose with some of these kinds of
High risk kind of thing.
higher
Yeah.
risk
Okay.
moves.
Okay.
Um,
So trade off, but it would be wonderful if they did both. Like they provided, uh,
I am
good
not
healthcare
here. I'm
and
not here to hate on anybody. Maybe Vince
sure,
McMahon from WWE, but I'm
sure,
not
sure.
here overall to hate on wrestling.
Yeah.
Just these are different ways of doing it, and this is why these moves were banned.
Okay.
Another one, the diving headbutt from the top rope.
Okay.
Popular for years and years, invented by Harley Race, and
Sure.
people like Daniel Bryan, Chris Benoit have all used it. It was used by everybody in the 1980s, uh, but it was banned by WWE after being linked to CTE,
Sure.
which of course is the same kind of concussion injury or chronic traumatic encephalopathy that has been made so famously popular by football movies.
Yes, and football in and of itself, the National Football League and I believe the NCAA, National Collegiate Athletic Association, have both. I think the NFL paid out a lot of money, and then started making strides to preventing CTE, and NCAA likewise has been making moves to help with that. But I don't know if that's being taken as seriously in wrestling. I do know, for instance, Josh, if you're a boxer, right, and you take a certain knockout or level of concussion, that you can be taken out of the ring for something like 30 days, like a long period of time. And you have to prove that you're completely back with it and everything and pass a medical exam before you can box again. I don't know if the same is true for wrestling.
Yeah, and then finally, the pile driver, and this is not a complete list of banned moves. These are just some of the ones that I thought people might recognize
Sure,
if they
sure.
are wrestling aficionados.
Yeah.
Uh,
The pile driver is the one where one person is like they're upside down compared to the person delivering the move, right? And you're actually driving the person's like head first into the mat that way.
yeah, and it's seen as one of the most lethal moves in the WWE.
Ooh.
And currently only a few top stars are allowed to use it. So it's not completely banned, but you are restricted depending on your level of talent, skill, years of service on who is allowed to do it under whatever name. Um,
Gotcha.
and for example, uh, Stone Cold Steve Austin
Yeah.
was on the receiving end of a botched pile driver from Owen Hart. And
Okay.
you may have noticed that Stone Cold isn't wrestling anymore.
Yeah,
And this
yeah.
was
I mean, it's been a long time, but
yeah. So
yeah.
this happened in 1997.
Wow.
Um, and Hart went for the move on Austin, but Austin's head was too low. So as soon as his head hit the mat, he suffered a neck injury, from which
Ooh.
again was able to recover, but was forced into early retirement due to essentially a loose spinal cord, like a loose disc in his neck, in that cervical area.
Meaning that if he re-injured that same area, there was a very, very high risk of paralysis or death.
Yeah.
Okay.
So those are some of the things that I don't know. Had you thought about the medical issues in wrestling, Santosh? I'm gonna guess you hadn't. But
Yeah, I thought, I didn't think of it as broadly as you taught me about today. I knew about the infectious diseases kind of things just from athletics in general. And of course, herpes gladiatorum sticks with you pretty well just because of the name of it. But I wasn't aware of the breadth of pathology. And then, more importantly, what was being done about it and how wrestlers are actually addressed and cared for.
so we've reached the end of the episode, and before we do our sign off,
Yeah.
Santosh, do you
Yes.
have a wrestling name, entry music, and special finishing move ready for me?
All right. Uh, I'm gonna go. I want to keep my rap name. I think I like it. So I'd love to go with Penicillin if it's okay to keep that as a wrestling name. Is that okay?
It's your wrestling name, my friend.
It's so good. Yeah, absolutely. Uh, and I want to go with a slightly goofy entrance music. I'm gonna go with the witch doctor. Like I told the witch doctor, I was in love with you. I don't know if there's a hardcore like a metal version of that, but I think especially like if you got ACDC or someone to sing it, it's like ooh ee ooh ah ah. Like, I think that would be so good. Absolutely. Yeah, yeah. And then I don't know what the uh what the move would look like if it was my finishing move or everything, but it would sound really like bloody and kind of a thing. We call it the incision and drainage. Like,
Oh,
oh, he's going for the IND, kind of,
I
so
like I like that we
yeah.
both went with medical ones.
Oh yeah, of
So,
course.
like you, I was torn between just remaining Dr. J
Uh-huh. Oh yeah, absolutely. Yeah, yeah.
or going for my luchador alternate identity, El Malpractico.
Oh, El Malpractico is fantastic. Yes, yes.
I would enter to, depending on the match, either Bon Jovi's Bad Medicine.
Oh, okay. See, you know more of these these pop music than I do. I was stuck a little bit,
Hey
but
yo, it's like bad medicine. Bad
nice.
medicine is what I need. And my finishing move would be
Yeah.
called the desessitation.
Oh, that's a great play on words. Okay. All right.
Dr. J
Yeah,
desessicating his opponent.
yeah. Oh, that's so good. Okay, so it would probably involve some sort of like chest compression, but like mean, like yeah, kind of a thing.
I mean, I'm picturing at least some high flying off the ropes.
Yeah,
Not a diving headbutt, as we've noted, it's been banned.
sure,
Um,
sure.
maybe maybe a suplex, maybe some kind of elbow drop. I haven't quite worked out
Yeah, because if it was an elbow drop like across the chest, right, that would be oh
Mm-hmm.
bang. But you'd have to time it really well in the theater of professional wrestling. A lot of the times you don't want to actually land the blow heavily. You actually want it to look scary, but not actually injure your partner because that's your partner. So yeah, you'd have to time it just so that even when that elbow landed, it was like kind of on top, and then the heel, right, the person who's your bad guy is going like that, like crunching up, and
Oh, see, I already viewed myself as the heel.
oh, you're a bad guy. Oh
I'm
my
a bad
gosh.
guy.
Okay, gotcha. You're
I'm a bad.
like
Oh, Dr. J's knocked him out with a desessitation. Insurance isn't gonna like that.
oh, yeah, and then you could say something like, "Oh, that you know, and his that guy's claim has been denied by Doctor J."
Oh, there's so many medical puns. Like, I'd
Yeah.
have moves called the vaccination. Like, I've thought about this in a lot more detail than we're going into in this episode. But we'll save that for maybe our behind the scenes folks who sign up for our mailing list or support us on patrons because, hey, that's it for this week. As always, we love to hear your comments, questions, and feedback. If you'd like to support us spiritually, emotionally, or financially, links to do that are in the show notes, along with links for further reading. If you'd like to be kept aware of upcoming events, sign up for our mailing list at travelmedicinepodcast.com. Our theme music is composed by Rachel Leisure. The show is produced by me with a ton of help from Dr. Santhosh and friends.
Hi.
And until next time, as always, keep a song in your heart, soap on your hands, a shot in your arm, a wrestling theme in your head. Spin a globe, pick a place when you've done all those things, and happy travels.
Top rope suplex.